Okay, everybody, this is Robert Ferguson, and you are here where we talk about diet-free life. And we talk about it all the time, and we talk about different things. And I want to say welcome if you're here for the first time. I'm your clinical nutritionist, a guy who shares because I care, and today is no different. Now, if you are here for the first time, if you're on LinkedIn or some other social platform like Facebook, I want to invite you over to our YouTube channel. Subscribe, make sure you hit all so that whenever we upload a new video or we go live, you'll be notified. And our goal is to go every day. There's always something to share that could be very helpful for those who care when it comes to our health. And I like to give away a lot of information, not sell you on anything, but just really give you information that is relevant now. And when it comes to weight loss, insulin resistance, joint pain, discomfort, anybody who wants to address this thing called inflammation, then I talk about it all the time. And the reason why I talk about it often is because inflammation is something that we all can relate to. Now, why is it that I say that? Well, before a person has any chronic condition, that means that you had inflammation. So inflammation is the base for all chronic diseases. Like I was talking to some specialists yesterday who specialize in and do a lot of work in genetics and cancer and prevention and all that stuff. And I asked them this question. I said, hey, would you agree that before a person has any type of cancer, there was some level of inflammation in their body? And they said yes. When I talked to an eye surgeon or someone who specializes in eyesight and what's taking place with our eyes, when I talked to dentists, same thing. Inflammation comes up. So what if there was a way to actually find out what your level of inflammation is? Because there is. It's an at-home test, and everybody can have it. I may even show it to you today. It's a little test, comes like this. It goes to the #1 lab in the world that does this type of testing, and inside of 10 to 20 business days, you'll get your results, and then you'll know. Now, today, I'm not just going to talk about inflammation. I'm going to talk about this switch where inflammation gets turned on and then it gets turned off. Because inflammation is not a bad thing. It's actually a good thing. Like if you hit your knee or scrape your finger, get a bruise, a cut, then inflammation comes to the rescue. So it's a natural thing that happens when we are injured. And it helps contribute toward the recovery, the repairing of what is damaged. The problem with inflammation is when it's not acute, right? Because that's an acute situation. When it's chronic and it's ongoing, and I'm talking ongoing for a long time, even when you don't feel it, if it's taking place, it sets the precedence. It puts you in a position where it's like a volcano is going to happen. Eventually, it's going to lead to one of those chronic conditions. So it only makes sense that if you want to reduce the likelihood of a chronic disease, then make sure you have a strong handle on inflammation. Actually, that came out. I'm surprising myself today. I'm on. Okay. Now, for those of you who are looking for a solution, whether you want to lose weight, you want to improve your health, nutrition is a big part of it. And we have an easy baby step for everybody to learn the basics of how to eat, right? Don't just count on supplements. Learn how to eat regular everyday food in a way where you can not only lose weight, but you can improve overall health, and you can tackle the concerns from a nutrition standpoint of inflammation. Because in our challenge, we actually show you how to identify whether or not you are insulin resistant, which is 93% of the population, according to Tufts University, or maybe you're not insulin resistant, which is only 7% who have what they call metabolic flexibility. So you learn these terms, and when you know, well, you know. And if you don't know, as the saying goes, you better ask somebody, because you got to find the answer. But as it pertains to what we're talking about, you don't got to ask anybody. You can just ask me. All right? All right. All right. All right. All right. Now, I'm not going to keep you long. Okay. All righty. Now, the article that I have made available in the link, you can go to it. You can print it out. This is what it looks like. And in this article, I go into detail on these ratios called DGLA to AA. Now, the DGLA is an omega-6 fatty acid. It's anti-inflammatory, even though it's an omega-6. The AA is for arachidonic acid, which is inflammatory, and is on the omega-6 side. And when you look at that ratio, it gives you insight to whether or not your body is prone or positioned to turn inflammation off once it gets turned on. Unfortunately, most people are not positioned where it just turns off. So the inflammation stays up. Now, it's not high, because you may not even feel it. You can't smell it. You can't see it. It's called low-grade chronic inflammation. And this inflammation is a precursor to a person becoming insulin resistant, which is one of the reasons why many people struggle losing weight compared to how they used to be able to lose weight. It's one of the reasons why many people crave many things, because of how insulin works in their body. And when insulin is not working the way we want it to work, as far as how your body responds and works with it, then your body will primarily burn carbs or sugar for fuel, when you want your body to primarily burn fat for fuel. The good news is that you can fix a lot of that. Well, all of that being said, you learn about the food, but with the test, you learn about inflammation. And we have a test. You can email me, you can message me, you can ask the person more about the inflammation score that you can get from our at-home test. And then you will know. Okay, then you will know. Now, some of you may be familiar with a C-reactive protein test. Now, in the United States, that's very common, but a doctor has to be in a position, there has to be other symptoms. Maybe your hands are swollen, maybe they think it's rheumatoid arthritis, and then they can actually put in a request to get a C-reactive protein test. In Canada, they check that pretty regularly, which is great. I remember telling one of my clients and dear friends, Trudy, years ago, this must have been 2011, 2012. I said, you need to go get a CRP, a C-reactive protein test. She's like, well, what's that? Because she was feeling inflammation, talking inflammation. I said, just ask your doctor and they'll do it. She went, they did it, and then she focused on improving that. Well, C-reactive protein test is like an inflammatory test. It tells you if you have inflammation at the moment, which is great. It's kind of like going to the doctor, the dentist, and you have a toothache, and you know it's a toothache, and you can feel the pain, and you can feel the discomfort. And so you want to like, hey, I'm feeling some pain, and they go, yep, you got a cavity, or you got something else going on, a crown, or something fell out. They confirm what you already are feeling. So a C-reactive protein test, to me, is like, okay, is that a test that you have me do just to confirm that I have inflammation? So then you can prescribe certain medications for me, or maybe put me into the category where I have rheumatoid arthritis. Maybe that's the case. I don't know. But what we do know is that it tells you if you have it at the moment. What I am encouraging you to do is get our at-home test, because it's going to look at inflammation from a whole different panel. And your doctor doesn't get this test. They don't have this test. It's not even available. Now, an individual doctor may learn about it, because I have some of my clients who are doctors that I had them do this test, and now they make it available to their patients. So that's possible. However, you can take your health into your own hands. You can become your own health advocate by knowing what your inflammation score is. Okay, so let me go back to the switch. I'm gonna walk you through it. If you guys have questions, I'll answer it. But this is just one example of what this test will do for you, because it tells you if your body, with this test that I'm referring to today, a DGLA to AA ratio, is your body positioned or set up or in a place where it can turn inflammation on, and when the body's done using that inflammation, it can turn it off. Because if it doesn't easily turn it off once it's on, then it can stay on for a really long time, and that is not good. Because eventually that low-grade chronic inflammation that's taking place inside your body, which you're not even aware of, can put you in a position where it doesn't go well. Remember what we all know and what we know to be true. The base for all chronic disease is inflammation. And we're talking specifically inflammation is turned on. So in this test, you're going to get your DGLA to AA ratio. And this ratio is going to tell you whether inflammation can shut off, and you want it to shut off. And if you're in a situation where it's not looking good, here's the best news of all. There's a way to eat. There's a nutrition protocol. There's even a supplement for people who don't want to eat certain things that you can make part of your routine, and you can get it to where these ratios, as far as inflammation, are in a good place. That's just one test. Now, it gives you like these ranges, and I just want to read off the article. And again, I've made available, the link to the article. You can get the article probably over a cup of coffee or a cup of tea or maybe even some water. You can read it. I mean, we're talking 5, 6, maybe 7 minutes, and you can read this short article and you'll be more informed. And the article actually shares with you what fatty acids you want, how to divide them, basic math with any phone that has a calculator, and then you'll know. It's going to put you in one of 3 categories, okay? So the first one, if your score is above 0.15, then it's going to say excellent anti-inflammatory balance. That's where we all want to be. If your score is 0.10 to 0.14, it's going to say borderline. And that's early signs of inflammation. I see that a lot. Again, the cool part is that, yes, you see early signs of inflammation, but we have a quick way of fixing that. So then you don't have to be walking around living with low-grade chronic inflammation and not be in a position where your body can work. And that switch is easy to turn on, turn off. And then we have pro-inflammatory, right? Where you're more likely to be inflamed and remain inflamed, and that becomes dominant. That's when you're below 0.10. And I see that. So this is special. This really is. I mean, it's a special opportunity. And as I state in the article, which you'll read, it says that most people think inflammation shows up as pain, swelling, or stiffness. But inflammation usually starts long before you feel anything at all. So think about that. If the base of all chronic diseases, to include cancer, high blood pressure, if the foundation is inflammation, wouldn't it be wise for us to learn or know what our inflammation levels are? The one that's hidden, that's silent. Because once you know, you can calm it. And then that's one less thing you got to be thinking about or concerned about. That's what I like about it. It's 100% wellness. It's proactive. It's preventative. It's creating health instead of waiting for something to happen and then act. So if you just want to learn about food and learn more about this, take our 8-week fat loss challenge. It's available. You can start it anytime you want, anytime. I mean, we often get groups of people to start at the same time, but you can start any Monday is when I always recommend it. Tuesday, Wednesday, get a friend, get some family members, do it together. Create some accountability as a group. That's up to you. Read the article if you want to better understand this test. This test can be a major game player or game changer, because oftentimes when people don't know what they don't know, then they get the big surprise when they get diagnosed with something. Why not know? And even if you're in a situation when you're living with a chronic condition, find out what your inflammatory numbers are and get your score. And then instead of just accepting your situation because of your age, possibly, you can do something about it. Because when you test, you get your score, then you wait 4 months, which is the life of a red blood cell. You test again. And then you will know if what you've been doing between the first test and the second test works. There you go. All right. It is there. I want to say thank you. I appreciate you. Make sure you like, subscribe, tell me hi. I want to give a big shout out to Linda. I'm glad you caught me live, Linda. And for those who catch me on the replay, I'm saying bye to you in hindsight. I appreciate you, and I look forward to our next one. Again, make sure you subscribe. And if you have questions, my contact information is available. Feel free to email me any questions that you have, or if you want us to cover a certain topic, feel free to reach out and put in that request, and we'll do that, if not sooner than later. Okay, I'm Robert Ferguson with Diet Free Life. I'm honored. I'm thankful. Until the next one, God bless.
In a world of times, there's a new way to see. No more counting calories, just living free. Robert Ferguson's got the plan you need. With Diet Free Life, it's the key. No more starving, getting rid of inflammation. Choosing healthy choices, providing you with sound information. Bringing balance to hormones and insulin through food. With DFL, teaching you food choices to see you through. DFL, we're teaching you to eat food right. Teaching you to pair food with each bite. Balancing our body's microbiome, feeling so right. With Diet Free Life, your health future's